Kevin Juanda, the first author of the Brca 1 and 2 somatic mutations in high-grade serous epithelial ovarian cancer that were underwent surgery in Dr. Soetomo General Hospital in Surabaya. Our study came from the background that the ovarian cancer remains a challenge in our developing and developed world. It is a challenge to determine the risk, and also it is challenging because there are a lot of cases that were diagnosed in advanced stage, and thus it is important that we have a very good management for those with advanced cases. The presence of Brca 1 and 2 somatic mutation might help with those that need this targeted therapy as management. There are still very limited data regarding the somatic mutations in high-grade serous ovarian cancer, especially in our developing countries such as Indonesia. And to date, there are no data that were reported regarding the number of somatic Brca 1 and 2 mutations in Indonesia. Our study is determined to know the number and the incidence number of the somatic Brca 1 and 2 mutations among the high-grade serous epithelial ovarian cancer that underwent surgery in our institution. So the diagnosis of the ovarian cancer and the histopathological type was confirmed via the surgery. So we gathered the data, the histopathological data of the patients that underwent surgery in our institution and those with the high-grade serous epithelial ovarian cancer type. And then afterwards, we gathered the histopathological sample, and then they underwent the next-gene sequencing to extract the DNA material. Afterwards, it was analyzed to detect any present mutation in the Brca 1 and Brca 2 sequence. Those with positive and negative result also examined and recorded regarding their clinical characteristic data from the age, menopausal state, parity, the length of treatment, including their outcome and survivability up until now. From our study, we performed a total sampling as the study was performed throughout 2019 until 2021. We obtained 26 patients with high-grade serous epithelial ovarian cancer, in which all of those cases we performed the histopathological analysis as well as the extraction. Among those 26 patients, we found 7 cases of positive Brca 1 and Brca 2 mutations, and there were 4 cases that were excluded because there are failures to pass the quality control stage. Among those patients that we analyzed, 84% were found in the stage 3, so it's already an advanced disease, and then the majority was diagnosed in the 50 years old of age group, and then the majority of patients are already in the perimenopausal state. We found no significant clinical characteristic data regarding to their Brca 1 and Brca 2 somatic mutation status. So, from the conclusion of our study, we found a quite high number of incidents of Brca 1 and Brca 2 somatic mutation in our institution. So we found 27% of cases of somatic Brca 1 and Brca 2 mutation among all of those that we performed the high-grade serous ovarian cancer that underwent surgery. However, we found that there were no significant clinical characteristic influence regarding their mutation status. We concluded that it is important to perform the next-gene sequencing as a screening for those with ovarian cancer that were already confirmed as the high-grade serous epithelial ovarian cancer type, because it might help with the decision-making regarding the targeted therapy that might affect and influence their disease-free survival and progression-free survival in the upcoming years. Thank you very much.